Thank you for joining us on this very busy Monday morning, everyone. Today we have my friend Charles Gaba. He's a nationally recognized healthcare analyst and he tracks policy and politics at his site, acasignups.net. I've known Charles for about 15 years, but now everybody seems to know him. He's done work for the Center for American Progress, and his work tracking the Affordable Care Act has been cited in outlets from the New York Times to CNBC and many, many others. And so during the second Trump administration, Charles has been breaking down the numbers of how many people stand to lose health care coverage with cuts to Medicaid and the ACA. And also, as Trump and Doge have been on a tear deleting federal data and websites, Charles has joined other health experts by trying to preserve Centers for Disease Control and Prevention information online. So, anyway, with that introduction, thank you so much for being here, Charles.
Thanks for having me. Appreciate it.
Great. Well, we've got a lot to talk about today on the health front. I wanted to start with RFK Jr. He's at it again with all sorts of things. In the last week or so, we saw that Trump's health secretary took his grandkids for a swim in fecal-laced waters. He also told Congress that Americans should not rely on him for medical advice, which on one hand is obvious since he's a conspiracy theorist and an anti-vaxx crackpot. But on the other hand, he is also the top health official in the country because he sucked up to Trump effectively. And then there are a couple other policy things that have gotten a lot less attention. He's called for this bogus review of the abortion pill that's based on junk science. And
Mhm.
bottom line, that could just make it even harder to get access to reproductive health care since the Supreme Court overturned Roe v. Wade in 2022. And RFK Jr. is making it a lot harder to get the COVID vaccine by severely restricting access to Norovax unless you're 65 and older. So, Charles, do you think Trump could have picked a worse HHS secretary? And what does all this mean for us and our health?
He probably could have picked someone worse, but I'm not. But it wouldn't have been easy. You know, I mean, he could have picked someone who is dead, except like they would have done nothing, which would have still been better than what RFK Jr. is doing, and yeah, I mean, all those things you mentioned, of course, they're all awful and concerning and terrible and all that. I'd also like just to add to that because there's so much to add, but one in particular is this autism study that
Right.
basically he's getting together with like all of this private, personal, presumably, HIPAA related personal data that they're mushing together that they basically, that Doge has basically stolen from like from other agencies and so on, and they're mushing it all together to do this big study about what's actually causes autism and such. That's something that's deeply, deeply concerning because we're kind of delving into the eugenics
Right.
field here.
I mean,
Um,
it's under the guise of helping people, but I mean, it's really stigmatizing people with autism, isn't
yes.
it?
Absolutely, absolutely. And the reason why and you mentioned about the uh, abortion drug, and I'm gonna call it that because I always mispronounce the name, so I
And there's
apologize for
two that
that.
are very similar.
Right, right.
So, right.
But on that, there's something else that I think people related to this that people should be aware of. So there's a Supreme Court case. It's been winding its way through the court system for years now, but it's called the Braidwood case, and this has to do with it's another attack on the ACA, and basically it has to do with the preventative care provisions of the ACA that says that if you have an ACA exchange plan, that you cannot be charged any out-of-pocket costs, copay, deductible, etc., for a long list of preventative services as long as they're done by by your primary care physician or done in network. And you would expect that the Trump administration would cave on that, and they would say, "Oh, by all means, tear that away and to tear away the ACA's ability to, to have these preventative services covered at no cost because he hates the ACA. However, uh, to the surprise of a lot of people, the Trump administration's Justice Department actually defended it in front of the Supreme Court. And when it was heard, I don't think they've ruled yet, but when it was heard, the general reporting, the gist of it was that it looked like the Supreme Court was likely to actually side with the or I'm sorry, to side with the government and therefore defend the law. And you would think, oh wow, that's great news, and it is good news, except that when you sort of peel the onion back, what it basically allows, there's a board, there's a panel of experts that are supposed to say, okay, these are the list of services that have to be covered, and it's good that they're still allowed to, hopefully will still be allowed to do that, except that the question is, well, why is the Trump administration siding with that? Well, the person who has control over that board ultimately is the HHS secretary, which is ultimately RFK Jr. So basically, if they win, it's sort of a monkey's paw situation where great, this panel can decide, except that look at the guy in charge of that panel. So you tie that, when you look at that and you look at what else he's doing, I'd be a little concerned about that.
Right. Um, let's talk a little bit about former President Biden. Yesterday we had some sad news. He announced that he has an aggressive form of prostate cancer, and of course this all came amid ongoing revelations from Jake Tapper's book about his health issues. So I know that you have been very complimentary about Biden's policy accomplishments. But do you think that he should have bowed out in 2023 so that there could have been a Democratic primary process in 2024?
I So I was one of those who last summer, after the debate and caused so much concern, I was one of those who felt that he should stick it out at that point for quite a while. But that's mainly because I'm a traditionalist in terms of he's the incumbent president, first term with a phenomenal record, et cetera. All sort of the fundamentals seem to be like, why would he drop out? He seems, he had a bad night, etc.
Mm-hmm.
Um, and but I think it's important to, what's done is done. I mean,
Mm-hmm.
but what I also said was that if he was going to drop out, that there was only one other person who it would make any sense to be the nominee, which was, of course, Vice President Harris, who I'm also a big fan of. So, it just never made any sense that there was no one else who could use the money that they had raised, et cetera, et cetera.
Mm-hmm.
There was a lot of legal and logistical reasons why it had to be her, not to mention that she is the sitting vice president, and her job is literally to take over in case he's unable to, continue as performing his duties. So, like, that I never understood all this fuss at that point about
Mm-hmm.
it being anybody else. Whether he should have, dropped out earlier or announced that he wasn't going to run after, I don't, I can't say that there might have been other factors involved. I don't want to speculate. What I will say is that, first of all, um, my heart goes out to him and his family, and I pray for a full and speedy recovery, etc. Um, and one thing that really, really bothered me yesterday when the news broke about this was that there were a lot of pundits who were immediately pouncing,
Mm-hmm.
and to the point of claiming conspiracy that it was a cover up, that they've known about this for a long time. You know, my my father died. This is going back almost 40 years, of course, but my father, when I was 18. My father died of a brain tumor, and he started feeling a little dizzy, and I believe it was early June, which was actually like at my high school graduation. He was diagnosed a couple weeks later as having a tumor. He had surgery a few weeks after that, actually on my birthday,
Oh.
and he ended up dying in mid-August. The time from when he first started feeling any sort of symptoms to when he died, that was like about 9 weeks. And I was told at the time by his oncologist that that particular type of in his particular situation, that there would have been no way of detecting it more than maybe a month or so before he started feeling those symptoms. So that you're talking about maybe 3 months, 3.5 months from start to finish. Now, of course, this is over 35 years ago. Medical technology has advanced tremendously since then. You know, they have early detection, et cetera, et cetera. I don't, but my point is that I don't know what the situation
Hmm.
is. I'm not a doctor. I'm not privy to the inner circle or anything of President Biden. Um, it's possible something will come out that, oh, there was this, that, oh, they knew, but we have no evidence of that. And for anyone to speculate about that, I think is pretty repulsive, honestly,
Yeah.
especially if you have no internal knowledge. And the other thing I'll say about that is that up until yesterday, all of this was, there was all this speculation that about him, about mental acuity and all that. And so
Hmm.
they're saying, oh, well, this doesn't prove it. One thing has nothing to do with the other,
Hmm.
you know? Some of the sharpest minds in the world have come down with cancer. One thing has no connection to the other. So
Hmm.
I'll just throw it out there.
Well, what a lot of people might know is that in addition to being a policy wonk, you're also a fundraising powerhouse, which you proved last year. You run a site called blue24.org, and that basically makes it easy for people to donate to Democratic candidates at every level, federal, state, local. And last year you raised about 13 million for Democrats, and that was about 9 million for Kamala Harris, correct?
Yeah,
Or
it's actually been updated to blue26.org for this current
blue26.org.
cycle. Yeah, yep.
And
It's
yeah,
the
and
same
so
site. Yeah.
yeah, how did you get the idea to do this, and so how different is this from like your typical super PAC?
Well, first of all, it's not a pack at all. In fact, it's not
Right.
an organization at all. It's literally just a website that I set up, and all the sole reason for the website is just to have a one stop place, a one stop shop for a bunch of links to Act Blue pages that I set up to raise money directly for Democratic candidates. That's all the site is. It's just so that I don't have to list a bunch of long URLs. But yeah, I back in the 2018 midterm cycle. I was just dabbling with, I have an Apple account. I was just sort of poking around with the different tools and that you can do with it. And I realized that I know a lot of people, including myself, have received that the fundraising emails from some high-profile Democrat, who says, could you split a donation between me and so and so, some other
Hmm.
candidate that they're raising money for, and it'll be split 50-50. And what I realized is that with ActBlue, it doesn't have to be two. You could have three, you could have five, you could have 20. As long as they have, an ActBlue account, you can put them all on the same page and have a slate page. And you could have like 20 candidates that you're raising money for. And, somebody donates, $100, it'll be split, 20 different ways. They get $5 a piece, or however you want to do it. You can also customize it and say, I want 20 to go to this candidate and 5 to this one, whatever. And it's a really handy tool. And so I started playing around with that and creating a bunch of fundraising pages and just promoting them on social media. At the time, of course, it was Twitter, but nowadays it's mostly Blue Sky, although I cross post across other platforms as well. But that's it. And so during the 2018 midterms, I hope to raise like 100,000 for the entire cycle, and I end up raising about a quarter million. In 2020, I was hoping to raise 1 million, I think it was, and I ended up raising 6 million. Yeah, and then last in 2024, last cycle, I was hoping to raise 4 million, and I ended up raising about 13.5 million. 9 million of which was for Vice President Harris specifically. But as you said, it's not just for the federal races. I raised money for House races, Senate, governor, Secretary of State, Attorney General, et cetera. And what I'm really focusing heavily on is state legislative races. I've raised money for something like 600 candidates at running for state Senate, state House across every state. And yeah, so that's what I do. And I've done this. I do not receive any of the money. Like I set up a tip page last fall, sort of as an afterthought. That when people, after they finish donating to the candidates, if they happen to want to throw a few bucks my way, as hey, thanks for doing this, sure, but I do not receive a percentage. I don't receive a commission, and the money goes directly. This is not a PAC. the money that you donate, it goes directly to the specific candidates that you choose on each page. So that's really all it is. And basically just boil it down to, there's over 7,000 state legislative
Mhm.
races or districts, plus, of course, about 500 at the federal level. And of those, maybe 10% or so, maybe 600 or 700 of those are considered competitive. So I basically just make it easy for you to donate to those, to the competitive races, and a few others here and there that seem, like worth a gamble.
And this year, you're particularly concentrating on the state level races in Virginia and New Jersey, correct?
Yeah, I mean, well, then also, yes, Virginia and New Jersey, because they both have their legislative races during odd numbered years for whatever reasons, as well. And of course, they also have their governor's races. And then also there's been there's a couple dozen special elections that, have been playing out throughout the year. And so I'm raising money for those as well. We had the high profile ones at the beginning of April for, there were the two special House elections in Florida, plus, of course, the Wisconsin's Supreme Court seat. But there's also dozens of others scattered around the country, mostly for, state legislative races. And we've actually Democrats have managed to flip two in Iowa, I think. And then I trying to think. I think there was one in Pennsylvania, maybe, where these were considered, solid red districts where they managed to flip them by overperforming by, like, 25 points or something. On average, according to the down ballot folks, they say that Dems have outperformed by around 12 points on average so far this year in the specials. Obviously, that's no guarantee of anything. Turnout for special elections is very different, can be very different from for the general, but I'd certainly prefer that than the opposite.
Hmm.
And so, yeah, so I'm raising money for those as well. And the other thing is that I've done all this I don't have a mailing list. I've not sent a single email. I haven't sent a single text message. This is all just through, I set up a bunch of pages, a bunch of links, and I just post them on, social media, and I just seem to have been pretty successful at it. That's all it is.
Great. Well, let's go back to healthcare and
Mhm.
talk about some of these big Medicaid cuts that Republicans have been trying to push through and could pass the House this week.
Yeah.
So you wrote a great article for us recently going through some of these numbers.
Mhm.
And I know you've also been examining things by congressional district as well, which is really helpful to see what's going on in all of our backyards. So bottom line, how many people are we looking at that could lose health insurance, and why are Republicans doing this?
Well, the why they're doing this seems pretty clear. There's a couple of very obvious reasons. One is that they want to extend, Trump's tax cuts for billionaires, that, and multimillionaires and such, and corporations. That's the main reasons. In order to do that, they need to take a huge chunk of money away from someone, and that someone seems to mostly be Medicaid, just because of how the budget breaks out. That's
Mm.
what they've decided. The other reason is that, sort of an ancillary benefit from their point of view, is that, Republicans have always hated the Affordable Care Act, and they tried to tear the whole thing down last time around, and they failed. So this time they're basically just defund it. So on paper it'll all still be there, but there just won't be any money for it, and therefore, it'll collapse of its own accord. And the thing is that the easiest, from their point of view, way to target that is to go after the Medicaid expansion, because there's
Under
close
the
to
Affordable Care Act.
Yes, exactly. The Medicare expansion portion of Medicaid. There's around close to 80 million people enrolled either in Medicaid or CHIP, the Children's Health Insurance Program, which sort of overlaps with Medicaid. There's around 80 million people total, but about a quarter of that, 20 million of that or so, is through the ACA expansion to adults without minor children. And they think that's the easiest, chunk to go after. And it happens, that happens to be about half of those covered, through almost half of those covered through the ACA. So, um, so but yeah, so there's so in the Medicaid expansion side, there's around 20 million people enrolled through ACA expansion there. And that's what most of the focus has been on, and rightly so. But there's also another 24, 25 million or so Americans who are enrolled through the ACA exchange policies, healthcare.gov and such, where they, for the most part, receive financial subsidies to buy private insurance through the ACA exchanges. And that hasn't gotten nearly as much attention, but those folks are at risk as well because of something that Republicans don't have to do anything. This is not a case of them passing a bill to tear, coverage away or to tear the subsidies away. This is a matter of them not taking action to extend the enhanced subsidies provided by the Inflation Reduction Act, which are
That
set to
President
expire.
Biden signed.
I'm sorry?
The act that President Biden signed.
Yes, exactly. The President Biden and the Democrats in Congress, first under the American Rescue Plan in 2021, and then that was for 2 years, and then the Inflation Reduction Act extended those subsidies out by another 3 years, but those are set to expire at the end of this year. And if those do expire, that means come January 1st, there's around 24 million Americans enrolled through the ACA exchange plans who are going to see, in some cases, massive, and I mean literally through the roof, off the charts, increases in their net premiums, which in some cases they will simply downgrade from whatever the current plan is to a worse plan,
Right.
which is probably what my wife and I will end up having to do. Because just to give you, I'm not going to say how much we earn or anything, but in our case, if we were to stay on the same plan that we are and at the same full price premiums, and the subsidies were to expire, our annual premiums would go up by something like $6,000 next year.
Right.
Well, we cannot afford that, so we would probably have to downgrade to a worse plan. And it'll vary by state and so on. But in a lot of cases, people will simply be priced out of any coverage at all, and so they'll basically have to drop out of America. So they'll lose coverage that way. So the worst case scenario is up to something like 45, 46 million people could theoretically lose their coverage. It's probably
That's
not going to be
just
all of them.
massive. That's
Yeah, yeah.
massive.
Now the Congressional Budget Office, they released a projection last week based on a prior version of the bill. It changes day to
Right.
day. And I think they came up with something. They estimated that something like 13.8 million, I believe, would lose coverage. Most of that through Medicaid
Hmm.
expansion. And then another chunk of that through ACA exchange plans. That's based on the assumption that that version of the bill passes and is implemented, and that those enhanced subsidies do not get extended. However, again, I just this morning I heard the newest version, in order to win over some of the super hardliners, the latest version apparently would move up the work reporting requirements for Medicaid expansion, but to earlier than 2029, which I presume would mean even more people would lose coverage. And they're also talking about making some other changes that would make it even more draconian. So my guess is that the CBOs, would probably bump that up by a few million if they were to redo their estimates
Right.
today. Um, but yeah, and that's potentially up to like 45 million Americans. Even if
Wow.
it's only 13, 14 million, well, that's like a third of that. That's still a hell of a lot of people. And those, yeah, as you mentioned, I've been slicing and dicing the numbers by state and congressional district to show people just how many people could either lose coverage or see massive cost increases to
Hmm.
them for their coverage.
So let's take the state of Michigan, since that's where we're
Okay.
both from. How many people could stand to lose health coverage?
Okay, well, I'm going to bring up Michigan here. Let's see here. Sorry, bear with me a moment. In Michigan, as of the most recent numbers I have, there are around 530,000 Michiganders enrolled in ACA exchange plans statewide, and then there's around 740,000 enrolled in Medicaid expansion. So that's around 1.3 million, I think, between the two.
And there
Um,
are only 10 million people in our state.
yes, so that's
We're
so
looking at over
potentially,
10%.
yeah, that's around like close to 13% of the total population. Again, if you go with the CBO's estimates, which would be around a third of that, you're talking about, maybe 400,000 or so, 500,000 Michiganders. So you're talking about, maybe 4 to 5% of the population losing their coverage. And again, another couple 100,000 who in the exchange plans basically seeing their coverage get worse, their deductibles and copays increase, um, their premiums still going up significantly. And on the expansion side, even those who would not be kicked off the program would still be they would have to go through a huge hassle, jump through lots of hoops, lots of red tape, etc., in order to maintain their coverage if that were all to go through.
What do the numbers look like in a big state like Texas?
Well, Texas is the thing about Texas is they're one of the 10 states that has not expanded Medicaid. Uh,
Right.
so and this is, by the way, this is the other reason why they're targeting the Medicaid expansion population specifically, because there are 10 states which have not expanded Medicaid at all, which means that technically changes to expansion program would not affect those states because those people are already screwed. They're already hundreds of thousands or millions actually in Texas and Florida who don't have any coverage at all because they're caught in the so-called Medicaid gap,
Mhm.
where they do not qualify for Medicaid, but they also don't qualify for ACA subsidies, so they qualify for nothing. But in Texas, in Texas, the expansion part would not change anything, but
Mhm.
the ACA subsidy part would affect almost 4 million Texans. There's around just shy of 4 million Texas residents are enrolled in ACA exchange plans. And that's around almost 13% of the population there. And again, they're going to be, if those subsidies are not extended, then they're going to see massive, massive rate increases, which again would kick, many of them would not be able to
Yeah.
afford, and so forth. The other that there's also, and in Florida, believe it or not, it's actually even more because Florida, even though it has a smaller population, Florida, for various socioeconomic reasons, has always had the highest percentage of its population enrolled in ACA exchange plans.
Hmm.
So again, even though Florida has not expanded Medicaid under the ACA, they have 4.7 million residents enrolled in ACA exchange plans, which is over 20%. So that's 1 out of 5 Floridians is
Wow.
enrolled in an ACA exchange plan. And yeah, they're gonna be hit hard if those
Okay.
subsidies aren't extended.
So, in addition to just the sheer horror of kicking people off healthcare, it also furthers another Republican goal, which is to really stick it to blue states over red states because they're much more likely to have expanded Medicaid.
Yeah, although again, when you look at blue versus red states, it's also important to remember that that's not the same as blue versus red districts or blue
Right.
versus red, zip
Exactly.
codes. And again, yes, it is true that like 9 of the 10 states which have not expanded Medicaid are considered red states. The exception to that is Wisconsin, which is like a swing state, purple
Right.
state. They didn't expand Medicaid under the ACA. They partially expanded traditional Medicaid. I won't get into that, but yeah. So yeah, from that perspective, they're saying, aha, the red states are the ones that didn't. Well, okay, except that a lot of red states did expand Medicaid.
Hmm.
In many cases against the governor or legislature's will, because it was done through ballot initiatives.
Hmm.
The people said we want to expand Medicaid. That includes Utah, Nebraska, Idaho. Some of these are very deep red states.
Hmm.
Nebraska, deep red state, South Dakota. All of those would be impacted by this. So a lot of red states would be hurt badly. But also, as I mentioned, the other part of it is the states that didn't expand Medicaid do have huge numbers of people enrolled in ACA exchange plans, and if those subsidies aren't extended, again, they're going to get hit hard as well. It's just a different population of people, but it's the same. It amounts to the same thing in a lot of ways. and also even within those blue states, you then have to drill down and say, okay, it may be a blue, California may be a blue state, but the district, there is a district in California, California 22, David Valadao, I hope I'm pronouncing that right, Republican congressman
Hmm.
in California, and in his district specifically, over 20% of the population is enrolled either through Medi-Cal, which is what they call Medicaid in California, through in Medi-Cal through Medicaid expansion
Hmm.
under the ACA, and then there's like another 23,000 enrolled in ACA exchange plans. So that's basically 200,000, around 200,000 of his own constituents. They would be hit. So California may be a blue state, but this is
Right.
a red or at least a swing
Right.
district. And yeah, he's going to have a very tough
Yeah.
time justifying that.
Right. I mean, California has millions and millions of Republicans. It's a huge
Hmm.
state. If you drive through the Central Valley when you're on your way driving between, LA and San Francisco or out to Yosemite, you're going to see a lot of pro-Trump signs out there. And a lot of
Right.
people are going to get hit. So I first want to talk a little bit more about the ACA side of things. And so, one thing that Biden was able to accomplish was decreasing the number of people who are uninsured and also making a dent in affordability for healthcare, which has just been a problem for decades.
Hmm.
Um, but, some of those things I think were not were not felt as much as, like, gas going up, or inflation for things that you buy every day. But come January, if all of a sudden your silver plan skyrockets and you have to take like a bronze plan with a $20,000 deductible, all of a sudden you're going to see a huge difference. Or if you can't
Hmm.
afford healthcare at all. And so basically, a lot of us are going to wake up to a giant tax increase next year, while billionaires like Elon Musk will get more and more of the benefits.
Yeah, I mean, I don't have much to respond because yes, that's what it boils down to.
I mean, so that's
Um,
lovely. We have a Robin Hood situation going on right now in healthcare.
yeah, well, a reverse Robin
Reverse
Hood.
Robin
Yeah,
Hood.
yeah.
Yeah.
Yeah, and there's not. I mean, I mentioned. I keep talking about these expanded subsidies because that's like the biggest, and most obvious part of it. But there's also a bunch of other stuff that President Biden put in through, through regulatory changes that have also helped improve the ACA. Made it more streamlined, made it easier for people to enroll, provided more funding for customer service and assistance, for people, navigators to help people along the way, and a lot of that has already been reversed by the Trump administration. Again, just through regulatory, you put what is done, live by the executive order, die by the executive order, and in
Right.
this case, die maybe literal. Um, but the House Republican bill, I believe it also includes legally codifying some of those changes that Trump is putting in. So it wouldn't just be for for the next 3.5 years. It would
Right.
be locked in, legally, presumably permanently. And so that I think they're counting some of that as some of these, savings as well. By locking these in, that means there'll be an extra 6 years where it would be legally cutting people out of coverage. So there's a few $1 billion to save that way as well. So um, yeah, and again, I don't think we have time to go into all of that, but some of these are pretty. Some of them are just kind of nasty. Like, I don't even know if they're going to save that much like money. It's just that they're just like mean just for being mean, which seems to be
Right.
sort of a common trait of the Trump administration.
Right. It's just like a combination of cruelty and enshittification for all of us. So,
Yes.
except the Elon Musks of the world, who are apparently entitled to everything. Um, but I think the last thing that would be good to talk a little more about would be more on Medicaid, because
Mhm.
there are a lot of misconceptions. I mean, first of all, there are a lot of seniors who are on Medicaid for their nursing home care. Um,
Mhm.
and just the language that we've been hearing from Republicans about the program has been like basically it's the new welfare. It's just another giveaway to the poor. They don't need it. And you're seeing this rhetoric about you've got to prove by working, to be on Medicaid instead of the fact that this is a health insurance program. This
Mhm.
is so you can go to the doctor, not, I want to get free money from the government to sit around. And so, do you think they're being successful with kind of pushing these myths about Medicaid, or do you think that enough people are aware that this is still very unpopular?
Well, yeah, that's something that, and I want to give a shout out to a friend and colleague of mine, Andrew Sprung. He posts under Ex Post Factoid.
Hmm.
He noted this I think about a month or so ago, when the campaign was sort of ramping up. He noted that Democrats and healthcare activists, that they were focusing because they knew that Medicaid was under attack, right? But they didn't know which portion, right? It was just in general. And so, of course, there's been there was this big push about there's this many millions of children and this many million seniors and this many million people with disabilities and so on, which of course these are the most vulnerable populations. And so they say, well, if you attack Medicaid, you're attacking all these groups. Well, that's the other reason why Republicans are going after specifically the expansion portion, the ACA expansion portion, is because there's traditional Medicaid, which has been for these various groups that you're talking about. And then you have the expansion program, which is specifically designed for people who don't fall into those categories. They're not children, so they're 19 and older. They're not seniors. They're basically 19 to 64. They're not legally defined as disabled, and that's important because
Hmm.
there's a lot of people who may be disabled or have a disability who do not fall into the official, they aren't receiving social security, SSA benefits or whatever. They're not blind, they're not, these very medically specific conditions. That doesn't mean they're healthy. It doesn't mean they aren't legally defined. But so these are basically, oh, and also they're not pregnant, right? So these are, and so they've used the term, quote, able-bodied adults. And the idea is supposed to be exactly what you said. And I think I mentioned that in my piece, it's the new welfare queen myth that there's, and Mike Johnson, speaker, he actually defined it as basically young men sitting around playing video games. So apparently, dude bros, playing online, multiplayer games. Apparently, these are the new welfare queens, from the '80s, right? Which were, at the time, the stereotype was a black woman, like a black inner city woman who has like 30 kids from, a dozen fathers, or that was the stereotype, and it was always bullshit then.
Right.
Well, I don't think that there's a lot of, young men, sitting around playing, Warcraft or Skyrim or whatever. Maybe I'm showing my age. I don't know what the latest, rage is, but that they're sitting around sucking up that, soaking in that sweet, sweet free healthcare, you
And
know.
and by the way, the Republicans did very well with that demographic in the 2024 election.
Yeah,
So that's an
exactly.
interesting choice.
Yeah, and so there's been study after study from KFF and other think tanks and researchers that have shown that I think it's something like well over 90% of those enrolled in Medicaid through Medicaid expansion either work full time, work part time, are in school, enrolled in school full time, are caretakers for other relatives who are legally disabled or what have you.
Hmm.
Um, but basically, you're talking about a very small percentage who do not who are not currently, or they're looking for a job, but there's a very small percentage who are not currently working and maybe are not looking for a job. Um, is it possible that there's a handful, that are just gaming the system by, I suppose anything's possible, but it's a very, very tiny percentage at most. And so what this has done, the entire point of imposing this, and it's not work requirement, it's work reporting. It's the reporting part is what
Right.
it's about,
Making it more
and you
difficult,
and
incentivizing people not to do it so that they're not part of the
exactly.
program.
and we have real world examples of them putting these into place and seeing the results. In Georgia, in particular, there's one work reporting requirement program for Medicaid that's active right now, and that's in Georgia. It's a partial expansion that's been around for about a year and a half, and they claim that something like 200,000 Georgians would be, eligible for it. Of those, they've only enrolled like 7,400 people as of last month, and that's after a year and a half, and that's after spending tens of millions of dollars in administrative costs as well as like marketing, costs and such. And it's a very, very tiny number. It's a tiny fraction. Whereas like North Carolina, which has a similar population size, which expanded Medicaid normally, fully expanded under the ACA, they just announced 650,000 North Carolinians enrolled through that. And the entire point of it, in order to save money for the federal government, is to kick people off the program. That's where the savings comes
Right.
from. If you discourage people from enrolling or kick off hundreds of thousands of people or millions of people who are on it already, hey, look at that. You just saved a bunch of money because you're not spending, federal dollars on it. And that also leads to one other reason why they're doing it this way um, is that it pushes the onus onto the states, because
Right.
Medicare is paid for, by the federal government. Medicaid is paid for through a split between the federal and the state governments. And so if you take away federal funding, now you're pushing it onto the states. So now you can say the states either have to cough up hundreds of millions or even billions of dollars per year to keep people enrolled, and if they don't, then the feds get to point to them and say, "Ah, well, just blame your governor, blame your state
Right.
legislature. It's not our
Right.
fault. Hey, we didn't do anything." So yeah.
And also, this has been tried for years at the state level, and a lot of these laws have been struck down by judges. And so, isn't this just another way of getting around that by doing it at the federal level?
Well, yeah, I mean, that'll be interesting to see. My guess is that there probably will be a lot of legal challenges to it, because so during Trump's first administration, he did, there were several states, Arkansas, I know that theirs got struck down. Michigan, our own state, actually,
Right.
we put in a law that added work requirements, and I think it was struck down within like 3 days or something,
Yeah.
within a week or two of it actually going into effect. Like, it basically never, before it was ramped up, it was shut down just because of the timing of the court case.
Hmm.
And I believe the main reason, and I could be wrong about this, but I believe the main reason why the judges struck those down, whereas they didn't strike down the one in Georgia, that the
Hmm.
difference was that in this case it was sort of a bait and switch, where basically these were existing programs that were already in place. So these states had already expanded Medicaid under the ACA under the existing rules years earlier, and now they were changing the rules, and that was the reason. Whereas in Georgia, they never expanded in the first place,
Right.
so they launched a new program which included work
Hmm.
reporting requirements out of the gate, and that's why that one was allowed to go
Yeah.
through, and it's still muddling along.
Yeah.
So yeah, if it and I don't know how much of that has to do with it being federal versus state, though. It's possible,
Hmm.
that if this were to be implemented, there might be uh, you know, cases filed against it for the same reason, that, hey, that for the existing 40 odd
Hmm.
states which have expanded, that you can't change, that basically you can't change the rules after the fact. So we'll see. I mean,
One
I
thing.
hope it never comes to that.
Right. I mean, but one thing that Republicans are really good at is they just keep pushing. No matter how many
Mhm.
times things get struck down by the courts, no matter how many pieces are written that the ACA is here to stay, they just keep going after it because their main goal is to give tax breaks to billionaires and to make things worse for other people. And so, they just don't give up. And that's why
Mhm.
it's up to us to fight back against it, because these cuts are not popular and these are affecting millions of us. And so it does make a difference to contact your members of Congress, whether they're Democrats or Republicans, because for them to hear from their constituents just what this means for you, and especially if you happen to be in one of those red districts. please, this is a critical time because, this is up in the House. So I just encourage you to do that. And this has just been such a great discussion, Charles. I think, hearing what this means, for people at human level, hearing just how many people are affected and this just vital research that you do, that, very few people do is just incredible. And I so appreciate you being here. I certainly hope that you will come back. And if you
Absolutely. Yeah,
want
it's been fun.
even it's been great. And if you want even more detail and more pie charts, Charles has them all at acasignups.net. You should go there because you will come out a lot smarter. I guarantee it.
Thanks a lot. I appreciate it, and appreciate having me on the show. And just one final thing relating to what we just said. There are, I believe, there's 29, I believe, 29 House Republicans who won by 12 points or less. And as I mentioned earlier, so far this year, in the about 2 dozen special elections, Democrats have been outperforming by around an average of 12 points. Now, again, that does not mean that all 29 of those are going to be flipped next year. I hope they all would be, but it does mean that that at least those are the ones that are at least potentially flippable. And yeah, I'm actually doing a post today. I have like every district, but I'm going to sort of here's these 29 that are 12 or less, that these are the ones sort of mainly focus on most closely, so look for that.
Great. Great. And thank you for everyone for joining us on this Monday morning on Lincoln Square. And remember, tomorrow we have Anchor Watch with Bobby Jones. It's our new show, and he'll be going through all the latest things in this run up to Memorial Day and Trump's big celebration to himself. So, coinciding with his birthday next month, which will be fun for us all. So, thanks. Please stick around. We have a lot of great lives this week on Lincoln Square. And thank you again, Charles, for being here.
Thanks for having me. Appreciate it.